this is exciting to be here to do this today and launch this this new set of acronyms for Brown School of Public Health, because we love acronyms here, right? I'm here to introduce to you both our Dean, Ashish Jha, and the Honorable Monica Medina, who are going to serve as panelists in the program later on. And we're going to talk to you about some of the exciting work going on in the center here, as well as hear from a conversation from Ashish and Monica Medina. I want to start with a brief overview of our annual Barnes Lecture and its history. So this is the 26th Barnes Lecture, which started under the leadership of Vince Moore in 2000, who at that time was the chair of the Department of Community Health. And it has continued throughout the tenure of Deans Fox Weddle, Bess Marcus, and Ashish. Named for Dr. Barnes, who came to Brown in 1962 as a founding faculty member of the new program in medicine. Dr. Barnes was excited about the prospect of developing physicians within the framework of a liberal arts college like Brown University, and so he began teaching an undergraduate course named The Informative Way of Life, which was wildly popular. One of his students, Jim Zisson, endowed the lectureship in memory of his parents because he viewed Dr. Barnes as the quintessential physician scholar. Mr. Zisson graduated from Brown with honors in 1974. Since graduating, his career has included being an entrepreneur, investment manager, the general manager of A&M Records, co-founding the Palm Healthcare Foundation, co-founding the Norma E. and Miles M. Zisson Comprehensive Breast Center of Palm Beaches, and serving as a trustee on many boards. Unfortunately, Mr. Zisson passed away earlier this year. A regular fixture at the event every year, we'll deeply miss his presence, but are grateful that his commitment to the public health will carry on because of his generosity. I next want to thank Dean Jha, whom I expect most of everyone knows in this room, for his support to our faculty and our professional research goals here, and for supporting the CCEH. As an accomplished physician, Dr. Jha joined Brown School of Public Health as dean in September of 2000. Before that, he was the faculty director at the Harvard Global Health Institute. Between April 2022 and June of 2023, he served as the White House COVID-19 response coordinator and as an assistant to President Joe Biden. Dean Jha is an internationally recognized leader in health policy, global health, pandemic preparedness, and response. And he's been a staunch advocate for illustrating the impacts of climate change, environmental pollution, and human health. He continues to draw this connection for the public. Last fall, he penned an op-ed in the Boston Globe illustrating how strengthening hurricanes threaten human health, and just today published a piece outlining how accelerating the clean energy transition can have immediate local health benefits. Under his leadership, the school has built a strong foundation in research on children's environmental health and has added new faculty and research strength in climate change, air pollution, and more, which has culminated in today's launch of the Center for Climate and Environment and Health. Joining Dean Jha today is in this conversation is our 2025 annual Barnes Lecture guest, Monica Medina. Monica is an Arnold Distinguished Fellow at the Conservation International. She most recently served as the first woman president and CEO of the Wildlife Conservation Society, and from 2021 to 2023, she was the Assistant Secretary of State for Oceans and International Environment and Scientific Affairs, and the first U.S. Special Envoy for Biodiversity and Water Resources at the U.S. State Department. As if that list isn't impressive enough, she's also founded an environmental newsletter that I'm sure many of us have read, and myself included, in Our Daily Planet. And Monica has a long and incredibly impressive career in environmental law, policy, philanthropy, media, and advocacy, including at the Walton Family Foundation and the National Geographic Society. In addition, from 2011 to 2013, she served as Special Assistant to the Secretary of Defense, and from 2009 to 2012 as the Principal Deputy Undersecretary of Commerce for Oceans and Atmosphere at the National Oceanic and Atmospheric Administration. So we're very fortunate to have a voice like Monica in these very challenging times, not only in the United States, but across the world. And so to get the program started, please give a warm welcome to Dean Jha and Monica Medina.
All right. You all can hear me okay? Fantastic. Joe, thank you for that terrific introduction. Monica, thank you so much for being here at the Barnes Lecture. This is really one of our sort of signature events that we do every year. And this year, as we sat down to think about who we would love to have, your name was at the top of the list, so I'm very grateful that you said yes. I want to start off more or less the way I start off these conversations, which is, since we have students in the room, and people often look at someone like you who's so accomplished, has done so many extraordinary things, and wonder, how did you get here? Was there a straight line? Were there zigs and zags? Do you want to take us sort of a little bit through the journey of how one becomes Monica Medina?
Well, Thank you so much. It is such an honor to be here, and I am really thrilled to have a chance to talk with my good friend, Dean Shah, and or Ashish, most of the time in my house. I did have a very windy path to get to my ultimate last few jobs. I started out as an Army ROTC student at Georgetown University. That was how I paid for college. And it turned out when I knew I wanted to be a lawyer. I went off to law school right before serving. When I came back out, the job that happened to be open that I got, I was lucky enough to get an honors program job in the Army General Counsel's office, and my client was the Army Corps of Engineers. And I started down this path on environmental law that really has led me to the place where I am today. And I have had a lot of different jobs. That makes me probably different than a lot of people in my generation, but a lot like people in younger generations who will move around in their careers quite a bit. And some of that had to do with politics and always wanting to be working in Democratic administrations. So I came and went in and out of the government. But my real passion for this particular field started when I had my daughter, and she turned out to have asthma. And that was a real concern as a mother, watching your child struggle to breathe. I really thought I've got to be part of whatever it is that can help kids like her get through the health challenge that is pollution. And so here I am. You know, many years later, lots of twists and turns. I started out as a Clean Air Act lawyer in Congress. After I worked for the Corps of Engineers on rivers and floods, I ended up being a Clean Air Act lawyer. And then I ended up working on endangered species and understanding eventually about zoonotic spillover. Just over and over again in my career, the confluence of health and environment and now climate change just kept coming up and kept being a focus of the work. So I'm thrilled, beyond thrilled, that universities like Brown are still willing to commit to studying this, even when, you know, green is not such a well-admired word in Washington, D.C. anymore. But I'm on the green team, as you can see.
I love it. We were talking about this earlier, and I made the point that universities have been around for a long time, and the only way they will remain around for a long time is if they think about the long run. And so it is really important not to get caught up in the politics of the day and say, oh, people aren't talking about climate anymore, let's stop talking about climate. Climate is important, we gotta talk about climate.
We do, and it is important, and it's a fact. You know, the temperature is a fact. It's not something that we can pretend isn't happening. We might want to think about it or talk about it in ways that appeal to people or help them to understand the import of it. And it's happening now. I think that's the misconception we have to get over, and that this program will help people to get over, which is that it's that problem we have to deal with in a few years, and today I've got to figure out how to pay for my groceries. Well, the reason your groceries are expensive is because of climate change. And so we definitely have to think about climate change as a today problem, and that's why, and one that impacts our health for the long term. So you may start to feel the impacts today, but you may continue to feel them for a long time in your lifetime. Like my daughter with her asthma, still carries an inhaler and all of that. So
I have some specific questions I was going to ask, but I want to stay on this topic for just 30 more seconds. It seems to me that part of the problem of connecting climate to health has been, in some ways, the way we talk about it. We talk about sea level rises, and people are like, well,
right.
If you don't really live at the beach, do you care? We often talk about
or is it better?
Maybe it's
according
better,
to the president. I don't know.
Or maybe, and the other way, we talk about 1.5 degrees Celsius, or maybe 3 degrees Celsius by 2100.
Right.
I'm like, 2100?
Right.
That's 75 years away. So to what extent do you think the problem of connecting what is happening to our lives has been folks in the environmental movement who've talked about it in terms that are not accessible?
I think it's a huge part of the problem, which is why I've loved the fact that I've been able to focus on climate and nature, or climate and health, because it is a way to express the problem in real terms for people in their day-to-day lives. So people care about animals. People care about endangered species. Well, that's one of the things that's happening because the temperature is rising. We won't have coral reefs if we keep going on the trajectory we're on, and I don't want to be a downer. But if we don't do something, we could lose all coral reefs by the end of this century. And we're already seeing the dramatic die-offs around the world in places like the Great Barrier Reef in Australia, this thing that everybody thinks of as the quintessential incredible coral reef, and yet it's experienced lots of die-offs. So that's one way to help people understand, is to relate to things they know and love, the idea of a world without elephants or without tigers, because of both human actions, but also because habitat is being shrunk dramatically, and a lot of that has to do with climate change. Sharks, yes, we're out there catching them like crazy, which is insane, but there are controls on that. But the fact that they're losing habitat is also, and that they're struggling against ocean pollution, which is, the oceans are filling up with plastic, sadly. So there are ways, I think, to help people to see that 1.5 degrees has always been, I think, a challenging one for people to get really wrapped up in or to get worried about. But when you see the number of severe storms, when I started at NOAA, one of my jobs was the number 2 person at our agency that in the federal government that is weather forecasting. And sadly, it's subject to lots of cuts right now, which we can talk about.
We'll come back to, yeah.
Yeah, but we started counting the number of billion-dollar weather events. My comms person came to me, said 2 things that were really interesting, and we acted on them. One was, there's this thing called Twitter, and it might actually help us get warnings and watches out better than our NOAA weather radio. Like, do it. And now, that's one major way that people learn about severe weather. The second thing he said was, this is happening a lot. This number of billion-dollar storms, man, there used to be, we'd count them, on one hand. And now, I think there are going to be more than 10 this year. And that was 2009. And of course, it's just continued to rise and rise. And it's a way for people to conceive of the destruction of climate change. When you think about entire communities like that, those neighborhoods in LA or parts of Florida or North Carolina, and we see it everywhere in the country. The numbers don't lie.
Let's talk about NOAA and infrastructure and science. So in public health, a lot of the work we do, not just in this new center we are launching, but really across the entire public health school and the entire public health field, we rely on scientific data from the US government. The national surveys, the household surveys, people's health surveys, people's attitudes, their behaviors, right? And that is the foundation for a lot of the work. And then, of course, there's data like what NOAA produces. Mm-hmm. What do you think, as you look at this administration's strategy around starting to make cuts in those data infrastructure, what do you think the implications are for the average everyday person? What do you think the implications are for people who study the impact of the environment on health and well-being? How do you see this landscape, and what worries you? And then I will eventually ask, what can we do to compensate, if anything?
Well, this is a great question, and it's one that a lot of people are thinking about right now, because the weather architecture of our country, and really the world, is built on a public-private partnership. So much of what is the basis for your local weather forecast here in Providence or anywhere in the world is these global models, weather models, that help to create the forecasts. And then they're made much better, much more readable, and communicated to people through local TV and your weather apps that everybody has on their phone. But without that basic data that NOAA collects, it is almost impossible to come up with the kind of accurate forecasts that we have had increasingly over the last decade and more. The science has been getting better and better. And the data has been collected for a long time. One of the things that makes NOAA's data so great is that it has been continuously collected in the same places for a century or more in some places. And the same, pretty much the same way. You know, we in the weather business in the government use weather balloons, essentially, these giant like kids' balloons, essentially, that have little data collection devices on them, and they go up, and the data comes into to NOAA, and they go up 3 times a day from the same places for 100 years or more. And I actually was lucky enough to go and do one of these weather balloon releases in the North Slope of Alaska, which is an important place to capture the data and to have that kind of consistent data. Without that, I think our forecasts will struggle. Now, we can rely on Europe and their forecasts, and you know, arguably they're as good at some of the basic stuff as we are. And hopefully that will remain available to researchers and to the private weather services here. But without that, I think you will see a degradation in the kinds of forecasts that we have grown accustomed to. And the last thing I'll say about this is when we started working on increasing tornado watch and warning times, it was a really interesting study in lots of ways, because sometimes when people had too much time, they tried to go somewhere else. So we had to do a whole other set of training around, no, you can't get all the way home. If you get one of these watches or warnings, just take shelter. And we did a whole tour on it around the movie Twister, the original one. And now we're cutting the very thing that gave us, you know, that margin of safety. And some of the cuts you may have read about in the Weather Service are of these weather balloons that are not going to be able to be launched here in New England because they don't have the people. NOAA's weather operation is an incredibly lean organization. There is not a lot of waste in it. And I am so worried about the fact that the way they've made the cuts is sort of helter-skelter. It's based on longevity in your job, or that random cuts in certain places, and then or random restoration of cuts because some very well-connected, usually Republican member of Congress can go and appeal and get their place put back into the budget. Those cuts restored. But if you happen to be somebody in a Democratic district, you might not get that. And the thing that really has been remarkable about our weather forecast is we have much more unusual weather than places like Europe, which is, you know, now we're relying on their forecasts. But, you know, we have a huge tornado alley. We have hurricanes. We have the kinds of extreme weather events that you don't see in many other big countries like ours. And so it is a very valuable thing to our economy. And NOAA ended up in the Commerce Department by accident because Richard Nixon was mad at somebody and didn't want to put it in the Interior Department. And it actually turned out to be kind of fortuitous because so much of our economy is weather dependent. So I worry a lot about degradation.
So 2 questions that are related, and I asked them staying on NOAA and weather data because I think about this a little bit for broader public health data too. So first of all, there are a lot of companies, a lot of businesses that rely on data from NOAA. So you would think they would be pushing back. And then one of the kind of standard retorts on this stuff is, well, if the data is important, some private company will collect it.
Right.
So thoughts on kind of the private sector, why are they not pushing back, or do you see private sector actors stepping in to fill the gap?
They're starting to push back, but I think the wealthiest companies believe that they can acquire the data themselves and don't have a very sophisticated understanding of what it is we're actually playing with here, the kind of fire that we're playing with by eliminating huge parts of this foundation of good weather architecture. Everyone's sort of gotten used to the fact that you can just pick up your phone and see a weather forecast, but that doesn't just happen. The other thing that will significantly change, and I do think insurance industry or the farm, industry, agricultural businesses are worried because the warnings and watches, the extreme events are the ones that are the hardest for those private services to do themselves. They totally take advantage of NOAA's willingness or ability, because they have sovereign immunity, frankly, to make those forecasts without worrying that they'll be liable for getting it wrong. And there is something about it being a public service, about it being a uniquely government function. This is why we have government. It's exactly for this reason. If you have seen, and not everyone's seen the pictures of what those LA neighborhoods look like, it's like a bomb went off there. This is crucial to our public safety, to our security. And the fact that they're playing with this fire is really, it's inscrutable, because it's so inexpensive. It costs you 5 or 6 cents a day, as a taxpayer. Who wouldn't pay that?
It does seem like DOGE is not necessarily focused on the most efficient way to cut government waste, but that's
another
it's
story.
a different point.
Yeah.
And the remarkable thing of eliminating positions and then having to get people back because they hadn't thought it through. My favorite example, of course, is all the nuclear safety inspectors who were all fired.
Absurd.
And then they realized, actually, we need those people.
Absurd.
Turns out we need a lot of other people, too.
Yeah.
Let me ask you a question that you and I have talked about before, and you alluded to this a little bit. But, for the last 10, 12 years, I have been, and this goes back to my time when I was at Harvard, I have been kind of making the case to the public health folks that we need to spend a lot more time thinking about climate change as a public health threat. And have found mixed sort of reception. Some people immediately agreed, and other people were like, eh. I have worried that people in the environmental movement have not spent enough time thinking about human health, and that there's a lot of focus on the planet, and yes, and animals and endangered species, trees, which we all care about, and we care about the planet, we live on this planet. But at the end of the day, we know that people don't vote on the planet, right? They don't vote on environmental issues as much as we may or may not wish that they did. They vote on the economy, and they definitely vote on health. So it's sort of a multi-part question, but first of all, do you agree with the premise that the environmental movement has not done enough to connect things to health? And second, what do we do to change that?
I do agree. I think, it's a two-way street. I think that it will be very helpful when the school is even more prominent, and when you've graduated a lot of students, that they go out and tell the story of how climate change is a part of our health security system, of how we keep ourselves healthy is by fighting climate change. But it's also fighting biodiversity. We're under a triple threat right now: nature loss, pollution, and climate change, and they're inextricably linked. And so I think that's another way that the environmental community, if you pull the lens out a little bit and you go beyond just the climate community, the environmental community is focused on health, at least somewhat. There are organizations, like my favorite thing, and I could definitely relate to this, as I was saying about my daughter having asthma, one of the most powerful organizations that grew out of NRDC and a couple of other big environmental groups is called Moms Clean Air Force. It's a great group. And it is a group of moms who cared about the health of their kids. There's great work being done by another organization called the Environmental Working Group on toxins in everyday household products. And they sang the chorus on PFAS, the forever chemicals in so many products for the longest time, and it just took forever to get that to have resonance in the public, but now it really does. So it does take time, and it does take a concerted effort on both sides, I think, and the environmental community tends to get sort of, or the climate community specifically tends to get wrapped up in degrees and greenhouse gases, which you can't even see, and it's hard to get people really as worked up about that. But when you start talking about things like their kids or their grandmother or their food prices being higher, or can I really warm something up in my microwave if it's in a black plastic container. Then you start getting to things that people care about.
Yep. Great. And by the way, we're going to open up to questions about 5 minutes. So let me just throw in a couple more quick questions. I want to talk to you about this new podcast that you started with a
Yes.
colleague, Scientista. A colleague here who was the first,
One of our
one
guests
of the first
is here.
guests. What motivated you? Do you want to talk a little bit about
Sure.
it, what its sort of focus on, and then what motivated you to do it?
Well, let me just say thank you for mentioning it, because we are growing it. It's relatively new. We launched at South by Southwest. It's myself and a behavioral scientist named Dr. Shweta Chakrabarty, who is a climate communicator in her day job. And so this is sort of a side hustle for the two of us. She has a wonderful producer, and she said, come do this podcast with me. It's called Scientista. We want to help women stay in science careers. There's a tremendous problem with underrepresentation in women in both science education and then in science careers in the long run. And the statistics are, not great. And so she said, we need to just talk about women in science and how they overcame hurdles and how they got to where they are, or women who are using science in their jobs, and that's how they became leaders in their own careers, whether it's media or business or government. And so we started this podcast, and we've had wonderful guests, and like Dr. Nikki Romanek, and we are so happy to be able to highlight the voices of women from all walks of life and from all stages of their career. And it's been, I think, we've just gotten started, so we're growing it. But I think podcasts are a way to reach a lot of people who aren't watching traditional media, who aren't going to turn on the news or have time to read that study. And so hopefully we'll catch on with younger women scientists, women at a school like this one, and many, many others.
And men scientists.
And men scientists,
who
yes.
wanna listen.
One of our most interesting guests was our first male guest, who was Astro Teller, who was the grandson of one of the founders of the Manhattan Project, and who now runs the Moonshot Factory at X, which is Google's science lab, where they're looking at the latest technology. He was fascinating, really, really interesting, and he told this great story about how he had been getting a lot of hits on his scientific publications. Somebody was trying to total up how many people had cited him, and it turned out that they were actually citing a study by his grandmother, who also has the initial A, Teller, and she published something at about the time of the Manhattan Project. She was working on it too, and it was one of the most cited scientific papers. And he said, oh no, I have to give credit to my grandmother, which was a great story.
It's a great story. It's a great story. All right, finishing up with one last question for you, which is, so we are in very complicated times. We have seen more of a frontal attack on the scientific enterprise than any time in my lifetime. For people who are like, oh, this is just reforms, these are not just reforms. And I think we can all agree that the scientific enterprise, the scientific process could be made better, but that is, in no way does it feel like that's what the administration is doing. And that is true certainly for biomedical science. It's true for environmental science, and it feels much broader than that. In that moment, what gives you hope?
Oh.
And what advice do you have for others to remain hopeful as they continue their work?
Well, I ask this question of a lot of people, so I'm not ever surprised when I get it. And I am optimistic. I want to say that over and over again. I still am optimistic for several reasons. One, because when I look at the natural world, I see that when we take care of it, it can regenerate. And that in itself is inspiring, right? I also see young people wanting to enter this field in numbers that I think would have blown my mind if you told me when I first started in my career, when I was in school myself, if you had told me that this many students would be interested in studying and working to save the planet, whether it's from the health perspective or from engineering. I think one of our biggest untapped potentials is design and thinking about circularity and sustainability as opposed to just, oh, we got to stop doing that because it's bad for us. So I think what gives me hope is that there's greater transparency. We have more data. We know more now than we ever have before. And with that knowledge, we can change. And the pollution in the world, most of it is created, all of it is created by us, directly or indirectly, which means we have the power to change it. We have the power. Every single person has the power to do something. You don't have to give up every modern convenience in your life. You don't have to walk everywhere. But everyone has the power to do something. And the first thing everyone can do is talk to people that they love and care about, their friend group, their colleagues at work, and just try to have a conversation about why this matters, why sustainability matters. You don't have to use the 1.5 degrees or greenhouse gases or green energy transition, or you can just talk about what matters to them in their lives and try to persuade them. If you're here, I suspect you already are a believer, but try and persuade them. That's the power we all have. Persuade them that taking actions matter, and that we can build a more resilient and a more powerful system of protection for the planet and for ourselves then by working at every level. And so if the federal government's failing us right now for reasons that we all know, then it's on us to help state and local governments and our neighborhood association, our friends, and even think about ways that what we do translates to better outcomes all around the world. So you can always find a way to do something that will be both sustainable, will help you feel better, will help you think about your future, and will make the planet better for the long run for everybody.
One of the things that your comments remind me of is our mutual friend Gina McCarthy, who's awesome. For those of you who don't know Gina, former EPA director, former first White House climate advisor. In a conversation I had with her during the early days of the first Trump administration, she said, "You need to stop whining, put on your big boy pants, and get to work. There's just a lot to do, and there's a lot states can do, there's a lot localities can do." And I am heartened by a point you made earlier, which is that there is a track record of progress. We know how to make progress. We have made progress. If you think about how much cleaner the air is today compared to what it was 30, 40, 50 years ago, it isn't like if we act, we may be able to make things better. We know we can make progress. And that's got to give people hope.
It does. And the other thing I'll say is, and yet, we can never stop caring for the planet. There is no silver bullet. We will always come up with the next technology. I don't think when I first started out I could have imagined the amount of electronic waste that we would create now, and the laws that we wrote are badly out of date when it comes to that. So we got to keep working on it. It's just our responsibility. It's part of what we have to do to be good stewards for future generations. So we can do things. We are not powerless. Every little bit helps, and we always have to be doing it. It's not something that we can ever stop doing, and it should be a joy, because we live on a magnificent planet that doesn't exist anywhere else that we know of yet.
Awesome. All right, let me open it up to questions, comments, thoughts from folks. Ira. And if you can introduce yourself, of course, I know who you are.
Ira Wilson, thank you for these comments. You talked about billion-dollar storms, and you mentioned very quickly insurance, and I wanted to sort of get both of you to comment on the fact that what may bring climate change to people's attention right away is the essential collapse, which is not yet happened but is incipient, of the home insurance industry.
Right.
And because it's national, not regional, storms in Iowa, and fires in California and floods in Houston affect the national home insurance market. And I wondered if you had any comments about this. This is a backdoor way that we, unpleasant way, we more attention may be brought to this issue, but it may hit faster than some of the other things that we've talked about.
It's absolutely true, and there are some people who worry that there will be a complete collapse. I think the insurance business is smart enough to figure out how to try to avoid that. But in some places, yes, well, and that will make people change their behaviors. It's a little bit challenging in the interim. You know, all these transitions are hard. That's why it's much better if we adapt and we think about it and we're able to plan appropriately. But that doesn't always happen. And, you know, places like Florida, the state is now essentially the home insurance industry, and California may be headed in the same direction. And so, yes, that is a concern that you know, we need to think about. And you know, we see this happen over centuries because people live in different places than they did 100 years ago. You know, there were all these mining towns in the West that were boom towns, and now they're gone. Because the industry left. And you know, I do think we will have to change, and there are ways that are going to force us to make those changes faster. But I will say, you go to Miami and you look at the kind of development that's happening on the waterfront there, and you wonder, what are they thinking? So.
That they'll be able to sell it to someone before the waters. Yes, there, and then we'll come to you.
Hi. Gail Costa, alum, human biology, many years ago. Two-part question, picking up on your final comments. How long will it take, do you think, when this fever finally breaks, how long will it take to reassemble important functions at the federal level that are gone or that are on the way out? And can you also comment on how effective regional responses can be? Because there is some talk about states banding together to provide some functions that aren't going to be provided at the federal level going forward, like FEMA, et cetera. Thank you.
So I think your question is a great one. It is going to be hard to put Humpty Dumpty back together again. I would be sugarcoating it if I said that wasn't true. But I am heartened by all of the researchers who are out there. We were talking about it earlier today. Alan and I are out there scraping data and trying to keep it alive and in the public domain. And we'll have to use some forensics, I think, to try to recreate some of it. And I wish I could say that there was, you know, a silver lining to this. I don't know that there is. Going to be a better way to actually access the data at some future point. But we'll just have to try to make up for that with other technological advances, with AI. And hopefully that will be good enough to put us back. And if it makes people appreciate what they lost, if it makes people stop and think, oh, the government was doing good things for me even though I didn't know it, then maybe that's the only real silver lining I can conjure out of it. On the other hand, I also think we are going to see a lot of technological advances that will help, you know, us do the things we need to do to protect the natural environment. We can't necessarily stop what's baked in already on climate change. But you know, when I look at the technologies that are being created to reestablish coral reefs, when I see the kind of new technologies available to let us observe the Earth in ways, maybe we'll be better able to protect it with some of that. So try to balance the wonder and the worry.
Yes.
Question for you, Dr. Zhao. My name is Peter Allen. I'm an anthropologist and an old friend of Fred Barnes. My question is about the new center. What specifically are the kinds of things you're going to be doing?
I was going to say, stick around for another 10 minutes or so. We're going to have a conversation just about that. So I'm actually going to punt on your question because we're going to spend a bunch of time talking just about that. All right. Other questions, comments, reflections? Right there. Yeah.
Hi, my name's Isabel, first year MPH student at the School of Public Health. Thank you so much for your wise words and expertise, especially your last sentiment. I'm very excited for the center launch, so this is really, really exciting. My question mostly focused on Rhode Island. I'm a Rhode Islander, lived in, born here, never quite literally left. So there was a lot of great points, especially about like what local governments and states can do. And I really want to tug on some of the work that Rhode Island's doing, but like what can be done more. So Rhode Island has their climate and decarbonization plan for large buildings. But how do we make sure and how do we get governments on board to support decarbonizing our healthcare systems and the supply chain to make sure we're building climate resilient and sustainable healthcare systems, because a part of being good stewards, just like you said, is being able to make sure that these systems of healthcare improve and are equitable and are here for our future generations and not taken out by, natural events or, New England's very semi-erratic weather pattern that we often see.
Well, I do think, and I meant to address your regional question as well, so I'll do both. I do think that these kinds of ways to work together have been a little bit subsumed by the federal government in the past. And this may, again, another silver lining, push those kinds of regional consortium. And leaders, I know you are thinking about the kind of the greater good here in Rhode Island. What could this public health school help hospitals around Rhode Island do? I think you can't minimize the impact you're having just by starting something like this, where you even have that conversation. Remember, a few years ago, I went over to the UK and did a meeting with their health ministry about plastic pollution. And because we're negotiating, I didn't mention it, but the world is negotiating, the US probably not so much, but not going to be part of it. But the world is negotiating an agreement on how to limit plastic pollution. And one of the biggest places where you don't want to throw the baby out with the bathwater is the healthcare system. Plastic is really important in hospitals. And it was the first place that the plastic industry went to try to defend plastic. And single-use plastics it was all about healthcare, and there were these unbelievable commercials about how they're taking your healthcare away by banning plastic. They want to take your good healthcare away. I don't believe that's the case. And in the UK, they were starting to think about, well, how can we minimize our plastic footprint in the system? Good ideas do have a way of spreading and helping other ideas to spread. And so if a school like this one is willing to take on sustainability, I believe the ripple effects of that will have impact.
One thing I will add to this is another sort of build on the Gina McCarthy line around, if you look at national policy, we sort of have this mental model that like one day Congress wakes up and says, we should do X. And then they pass it and the president signs it, and then it goes into law. As you all might imagine, that's not actually how it works. And often what happens, and this has certainly been true in health reform, if you think about the big changes in health that Congress has enacted, they almost all started at a state. You worked out the kinks, it actually worked pretty well. And then multiple states started doing it, and then eventually Congress got there and said, we should do this nationally. So if you think about decarbonizing healthcare, for instance, if Rhode Island could lead the way and really have a decarbonized or carbon neutral or ideally carbon-free health system, it would inspire other health systems to do this. And as the movement gets going, you're going to see more national attention and national pressure to act nationally. So I really do think this stuff begins locally. And we always sort of think about what's going on in Washington, but there's a lot more that you can be doing here. Other questions, comments before we transition to our next part? So Monica, I want to say thank you. This was absolutely fantastic. This has been a really important, actually, we had Gina McCarthy here as the Barnes Lecturer literally 2 weeks after I left to go to the White House. So we had set up. You
passed each other on the
way. We had set everything up, and then I couldn't do it because then it would have been literally down the hall, and that wouldn't have worked out. So Megan Ranney, who was our academic dean at the time, did that conversation. But this has really been extraordinary. Thank you so much for your leadership. Thank you for coming down here today, and I'm really deeply grateful for this
Oh,
conversation.
my pleasure. Thank you all.
So we are going to do a little quick transition here. So I'm going to ask our three panelists to come up. I'm going to stay standing. I'm going to stand. I'm going to stand, only because I've been sitting. Oh. Can I keep my lab on? Look at that. Technology. All right, so as mentioned, this is a two-parter, and I want to move to the second part. This is something we've been thinking about for quite a while. And in some ways, it almost goes back to like early 2021, in the height of the pandemic, where Joe Braun and I went for a long walk. And we were talking about his center on children and environmental health, and started thinking about climate as a feature, not the entire overriding theme, but as a key component of how to think about environmental health at the Brown School of Public Health. And that conversation has evolved, but I think ultimately, over the last year and a half, coming to the conclusion that we have so many good people who work on the intersection of climate and health. Several of them are up here on stage. A couple of them are in the audience. I saw Rachel here as well. We have more coming. We have at least one more new faculty coming in July who is a fantastic scholar in this area, and possibly more, as you know, getting new faculty right now is a complicated thing. So this is an area where I feel like we have rapidly become one of the best places in the country on thinking about that intersection between climate and health. And then Joe has brought up on multiple occasions that climate's really, really important, and something that Monica said, it is not the only lens through which we should look at the environment and the impact of environment on health. And I will be completely honest with you, this is something which is a trap I often fall into. Whenever I think about environment, I go immediately to thinking about climate. Pretty big topic, pretty big, pretty important. But I think it is very important at this moment to say, yes, that's a big contributor to health, but so are all these other issues. And with all of that, in a very typically academic way, we have been debating and discussing this, and I think over the last year, decided it was time to take what was an excellent center that Joe was leading, not just rebrand it, but refocus it and broaden its perspective, and thus the launch of a new center on climate, environment, and health. And again, I'm super grateful that Joe has stuck with me throughout this entire journey. And we are today officially launching it. So the provost will be coming by. He's stuck in another meeting, but he's going to come by in a little bit. He'll listen in on part of the conversation. He'll make some closing remarks. But before we do, before we get to the provost, obviously, which is going to be in a little bit, what I thought is we'd just have a conversation. And I know all three of these individuals very, very well, but I'm actually going to ask them to introduce themselves. We'll start with Alan, then Joe, then Beth. So Alan, quick intro about yourself, then we'll go to Joe.
Thank you so much. My name is Alan Just. I'm an environmental epidemiologist, and I'm also the Nazareth Ferguson Family University Associate Professor of Public Health and a Associate Professor in the Department of Epidemiology and in Environment and Society. And as an environmental epidemiologist, I study how the heat in our neighborhoods and the quality of the air that we breathe relates to human health. And I'm just really excited to be at Brown, because I think that Brown is a place that's really participating in this conversation, the unique role of universities in setting the agenda for how our society needs to address climate and health and equity.
Thank you. So I already introduced myself, but I can tell you I do work as an environmental epidemiologist, mostly focused on environmental pollutants like per and polyfluoroalkyl substances, or the forever chemicals that Monica mentioned. And I've spent much of my career studying chemicals that come from plastic products and how they impact health across the lifespan. So looking at how in utero and early childhood exposure to these chemicals impacts the developing infant, child, fetus, and even adolescent. And we're now doing studies to look at how early life exposure to chemicals affects health decades down the road, and seeing if there is a link between our exposures in our mother's womb to the time that we're 50-year-olds. So this is an exciting time to be doing this work, because we can take advantage of these cohorts that have been following participants for decades now.
Hi, I'm Beth Fussell. I am a sociologist and demographer, and I work at the Population Studies and Training Center here at Brown, as well as the Institute at Brown for Environment and Society. And I began my career as a migration scholar studying international migration. So the way I ended up here in studying environmental drivers of migration is that I was an assistant professor at Tulane University in 2005 when Hurricane Katrina happened. And so I began watching everything that was going on around me, and I thought, I need to study environmental drivers of migration. At the time, there were very few people, if anyone, studying that topic. But it launched a new topic in my career that I've been studying for the past 20 years, with this year being the 20th anniversary of Hurricane Katrina. Over that period of time, people became more and more convinced that climate change was having an impact on the strength and lethality and damage potential of hurricanes. But initially, it was not clear. Now I think it's not controversial at all to say that hurricanes are becoming more destructive. So I'm really glad to be here at Brown University because, well, hurricanes don't get here very often, but also because so many people are coming together to talk about the interdisciplinarity of climate change and health and the environment and so many other things. So I'm going to mention that Brown this past year launched an initiative called Equitable Climate Futures, and I'm the co-director of it along with Baylor Fox Kemper, who's in the Department of Earth, Environment, and Planetary Studies, and we will be having more activities focused on bringing together faculty at Brown, students, and other affiliated researchers to think about how climate change is affecting anything that we study here at Brown.
Great. Thank you. Thanks, Beth. So I'm going to start off with Joe, and I want you to actually spend a little bit of time talking to us about these forever chemicals, because I keep hearing about them. They sound bad. And yet, I don't know that I have a clear sense in my head of where they're coming from, what do we actually know about their health effects, and what can we do to limit them or eliminate them or certainly reduce their impact? So three-part question, but it'd be really helpful for all of us, I think, just to get a better understanding of these things.
Sure. So this is a class of thousands of chemicals that are used in lots of different products, industrial processes, and in commerce. And they are a class of chemicals characterized by having fluorine molecules on them. And that carbon fluoride bond on them makes them incredibly resistant to chemical, thermal, and biologic degradation. And because we've used them in so many things, it's like we've scattered them into the wind. And it's like if anyone has kids at home and they play with glitter, it's like we've blown glitter out onto a carpet and now we got to clean it up. These chemicals stick to lots of things, and they're very good at moving through the water and soil and contaminating lots of places in our environment. So they're really hard to clean up. They don't break down, and it's really hard to get rid of them once we've dispersed them everywhere. In our bodies, they hang around for years. So we can measure the levels of these in everyone's blood in this room. And there's dozens of them in our blood. And they sit there for years. And so our exposure that we have today reflects things that we've been doing and the PFAS that we've been ingesting for maybe a decade. In terms of their health effects, they've been linked to a lot of different health effects. Kidney and testis cancer in grown-ups, low birth weight in babies. They've been linked to reduced vaccine response and seem to be immunotoxic. And they've also been linked to elevations in cholesterol. So there's a whole array of health effects that they have on us, and that could affect people at different life stages, whether they're infants, a baby in the mother's tummy, or even an adult. In terms of what we can do, this is the really sort of the sad part about them, is once they're in us, there's really not a good way to get them out. So they're stuck in us. And so this really highlights why we need to prevent exposure and figure out ways to prevent us from being exposed to them. Some of the things we're doing right now in the center is to try to figure out, are there certain things that people can do when they're exposed to these chemicals to ameliorate the effects of the exposure that they had historically? Because we're finding out more and more that there's people in communities where they've been exposed to these PFAS chemicals and they say, well, great, what do I do? I've been exposed for 50 years and now I'm at increased risk of cancer. And we don't have really good options of what to tell them. We can tell them what they can do to reduce their exposure going forward, but there's nothing we can tell them to do about their exposure going backwards absent a time machine. So we need to give people tools, whether it's some pharmaceuticals, physical activity interventions, or specific diets to try to help reduce their risk of the health effects associated with these chemicals.
And how good is the evidence about the health effects? Like, is it?
It's strong enough that IARC just declared PFOA a known carcinogen, so class 1A, and PFOS is now declared as a class 2B or possible carcinogen. The EPA came to a very similar assessment with when they reviewed the literature for establishing drinking water guidelines. And then several other national or international panels have come to similar conclusions. So it's really robust evidence.
Yeah. Without a very good set of solutions for what to do for the exposure we've already had. All right, Alan, switching gears a little bit, and then we're going to open up to questions, so please think about questions. I'd love for you to talk a little bit about your work on sort of looking at issues around heat, air pollution in a much more hyper-local way. I mean, one of the things that I've learned from your work, from watching you present, is, I often have thought about heat as like, okay, what's the temperature in Providence? And what's the air pollution in Providence? And what's the interplay? And that's bad for the people of Providence. But my sense is you think about this at one level more granular than that, or a bit more nuanced than that. So help us sort of think about the work you've been doing and how have you been putting together in terms of really trying to understand this stuff, the mapping and the much more kind of local approach to this.
Yeah, thanks so much. When we look at our phones, quite often what it's telling us is the temperature at the closest primary weather station. And so often that's whatever's happening at the airport. And historically, a lot of the early epidemiology of the health impacts of heat was based on whatever's happening at the airport. But in a place like Providence, not too many of us are actually living at the airport.
So sometimes we feel like we
can get stuck there. It happens, but most of the time we're in our individual neighborhoods, and it turns out that the temperature of those neighborhoods can vary block to block. There's a lot of nuance that relates to the land use that can be a legacy of decisions that have been made over decades or centuries. But it really does make a very substantial difference if you're in a neighborhood that has tall, verdant trees that are casting a lot of shade, or if you're in a neighborhood that's got a lot of dark pavement that holds on to that solar energy and radiates it back at night. And so when we are able to reconstruct what's happening in the past, thinking about variation in space and time, what we see is that what people are exposed to, it really can vary quite a bit depending on where they live, where they work, where they play. And so that means that when we're trying to do these health studies, if all we're using is that data coming from the airport, we're kind of getting the wrong answer. We're sort of making some very important mistakes and assumptions.
So that's a compelling argument for doing it better. So how do we do it better?
Well, part of it is that we need data that comes from our federal government. And so that's not easily replaceable. One of the tools that my lab uses is remote sensing from satellites that have been paid for by the US taxpayers. And so we have imaging of various kinds. We have thermal imaging that tells us about the properties of the land surface and its temperature. We're able to reconstruct, the height of the trees and the types of land cover over huge areas and going back in time. So we have this data that was prospectively collected by satellites that are in orbit that are kind of capturing this sort of remote sensing every day. Now going back, really solid data for 2.5 decades. For some things, it can be even longer. And so we're able to use that to augment, not just those airport monitors, but really starting to tease apart what's happening in individual neighborhoods using statistical modeling. We don't have a measurement in every neighborhood. We wish we did. That would require even more investment in data collection. But the gist of it is to bring together these kinds of monitors with models, with remote sensing, so we can do these better reconstructions. And when we get those better reconstructions, the story is that we've been underestimating the differences in what people are exposed to, right? We paint with a broad brush. We do some epidemiologic study saying that everyone in Rhode Island lives at TF Green Airport, right? And who is exposed to higher temperatures is not random, right? There's structural racism that has led to big differences, with residential segregation. Big differences in these land use means that there's really differential exposure to heat. The same story holds for air pollution. So we've underestimated the disparities in exposure, and we've underestimated the health impacts because we've been, using sort of too coarse of a resolution when we think about what people are exposed to where they live.
And do you think, to think about actions that could come from this, do you think we could use this level of resolution to make different guidance, let's say if there is a heat wave coming, that presumably you can predict which neighborhoods are going to be hit harder, worse, and then potentially change guidance, behavior? Part of what I'm trying to think about is, okay, so you have a much more precise estimate of the effects. That's really important. But what do we do about that?
That's right. So we need a societal investment not only in mitigation to reduce our greenhouse gas emissions, but also in adaptation. And I think that having better environmental modeling can help us direct that investment. So we are able to go and say, we have a project now where we've been modeling how much shade there is over every schoolyard, every school grounds in Providence. And so we're able to say, okay, working with community groups that are going in and doing neighborhood plantings. These are the schools where there is not enough shade for the kids to have a place to play during a sunny day. And so I think that kind of better environmental information can help us target our investment. We need to have the resolve as a society to make those investments, but it does tell us where we need to go in because people are going to have that additional exposure. They may have extra susceptibilities that leave them more vulnerable. And so if we want to adapt in a way that is equitable and in a way that helps preserve public health, I think that greater granularity of our environmental information can help target it.
I love that. So while more shade, more investment is probably beneficial for everybody, your targeted approach lets you target the places that are most vulnerable and have the biggest impact on health. Awesome. All right. Beth, coming to you. I want to talk about Hurricane Katrina, which you mentioned. So just setting it up, I was struck by, there was a paper in the New England Journal about 3-4 years ago, it's actually all blending, more like 6-7 years ago now, on what happened in Puerto Rico after Hurricane Maria. And the initial death toll from Hurricane Maria was 64, that was the official death toll. And then when investigators went back, I know you know this paper well, but when it went back, like 3 months later, it was closer to 3,000. Right? And a reminder that when we have these big storms, everybody counts the number of people who died in the first couple of days, but the impact, the real health impact, lasts weeks or months. And I suspect you're going to tell us it might last years. So talk a little bit about what we know about the impact of Hurricane Katrina on health, not just in the short run, but what have we learned about the effects on health and on well-being and all the other things we care about over not just weeks and months, but years and now decades?
Yeah. Well, it took a very long time for the death toll from Hurricane Katrina to actually be assessed because the devastation to the city was so tremendous. And I'm just going to remind everybody, and some of you in here may not even remember when Hurricane Katrina happened, but New Orleans is a city shaped like a bowl, and it's surrounded by water, and levees protect the city. So when Hurricane Katrina happened, it was only a Category 3 hurricane, which the city had withstood before. What made this event different was the levees broke, and that bowl filled up with water. Fortunately, there had been a mandatory evacuation of the city, so there were very few people left in the city. Those who were still there had evacuated to the Superdome and the Convention Center, and so they were in a relatively high ground in the city. I just want to remind you of that because people forget how extreme that event was through that failure. It's not like other hurricanes that we've seen in the since then. In terms of how this affected people's health and well-being, mortality is one indicator of health. There were about 1,700 people in Louisiana who died from the direct effects of Hurricane Katrina. Many of them were drownings. Most of them were over the age of 65. So they were people who were unable to rescue themselves for one reason or another. But then over the subsequent months and years, many people had to deal with being displaced, finding new healthcare providers. In the case of people who were on dialysis, they had to find new dialysis centers to treat their chronic diseases. And so we really have not been able to account for all of those knock-on effects of the hurricane on health. Although I will say, Ashish, I mentioned earlier that I'm doing this study of the long-term outcomes of Hurricane Katrina, and we did just have disclosed from the Federal Statistical Research Data Center research about return migration. Today, some of our results on mortality were disclosed. And so this is an ongoing process where we're able to look at the long-term effects of Hurricane Katrina on a variety of outcomes up to 15 years later. There are really two hypotheses about how how large-scale disasters affect mortality. One is that people die in the event, and when people die in the event, actually the risk of mortality among survivors goes down for a little while, because those who survive it are typically more robust, healthier. But then over time, you get some of the stress conditions that play out. And so you expect to see that some of those stress effects become evident in chronic health conditions and mortality. So there's a complicated relationship between disaster exposure and long-term health outcomes.
Yeah. Thank you for that. And this is a literature, I think, that is growing partly because the number of big storms has been growing. And I remember a study from a couple of years ago looking at cancer outcomes after a major storm. If you have cancer and you're undergoing chemotherapy, radiation, big storm hits, your healthcare just gets totally disrupted. And yes, you might be able to evacuate, but is your treatment continuing? Do you go back to the old place? And so as you might imagine, the data suggests that your mortality and your just general outcomes for cancer get much worse and it stands to reason. So these are super complicated issues. All right, I'm gonna have a couple more quick questions, and then we will open it up to the audience. And I saw Provost Doyle has joined us, and so thank you for being here. Frank, we'll let you come up and say a few remarks in a second. I'm gonna come back to Joe Braun for a second. And it's a two-parter. They don't seem super related, but they both have the words air quality in them. Corsi Rosenthal boxes, which I've been a big fan of. You did something, explain to people what those are, what you did, and what you found. And then I would love to hear about, I just sort of saw sprinklings of something about air quality in marathons. Given that we had the Boston Marathon a week ago, I'd love to hear about that. So two air quality questions for you, Joe.
Sure. And so I can remember it actually, Ashish. I was on a Zoom faculty meeting for the whole school, and you said something about Corsi Rosenthal boxes, and you said you wanted to put them in every room of the university. And I thought, wait, before you do that, we need to measure levels of air pollutants in the rooms before we do that, and then while we're doing it. So I actually connected with Robin Dodson, who's in the room here from Silent Spring Institute, and we did an experiment in the School of Public Health where we built these do-it-yourself air filters made out of 4 air filters that you put in your furnace, and a 20-inch box fan on the top, some cardboard and duct tape, and you've got yourself an air filter that has the same, if not higher efficacy than something you spend $300 on Amazon. It's a little noisier, but it's more effective, and it uses less electricity. And so we measured levels of these pollutants like PFAS, phthalates, and other chemicals that are found in our everyday environment in building materials and in cosmetics and other products. And we found that when we were running these fans, we could reduce the levels of these chemicals in the air by 30 to 60%. And we saw this in just this little small study with these 17 rooms in the School of Public Health. And so we actually followed that up and looked at other chemicals, taking what we call an exposome approach to this and looking at the totality of exposures. And when we looked at more exposures, we found that the levels of 70 chemicals went down. And this included things like combustion byproducts, pesticides, as well as other flame retardants. And so we were able to show that these air filters have a sort of a mixture effect in terms of being an intervention. So they're good for reducing levels of semi-volatile organic compounds. They're good for reducing air pollution, and they're good for mitigating respiratory diseases. So they can really be an effective intervention for a multitude of things. And so I think these sorts of do-it-yourself interventions that people can employ could have real impact, across a year. Whether it's during cold and flu season or during we're going to have wildfire seasons now, unfortunately. And so I think that's a way to do that. With regard to the air pollution, this was I'm a triathlete and a marathon runner, and I had this idea. Walking around thinking, Alan and I were talking about this, where I said, I wonder what the effect of air pollution is on marathon running. And working with some students here at Brown, we pulled together over 2 million marathon finish times from the 9 biggest marathons in the US going back to 2003, and we combined it with Alan's air pollution model data, where we could measure the air pollution level at every single mile marker of these 9 different marathons in every year that it was run, and look at that in relationship to the time people ran. And we found that people ran about 20 to 30 seconds slower for every microgram per cubic meter increase in their air pollution levels. And so that got published in Sports Medicine, and I'll probably never publish in that journal again. But I made it, I feel like, if I got published in Sports Medicine. So, but I think it's a real example of the kind of interdisciplinary work we're doing here in the center, because here we're taking Alan's air pollution data. We're having students help us do, they went on, these students web scraped from this website called Marathon Guide, where we had to scrape 2 million times out of this. And then we use complex statistical models to combine it all together and publish this really amazing work. So I think this just shows that there's this really unique interdisciplinary work that takes advantage of the great exposure assessment we have and the great students and the ideas that we're able to generate.
That's awesome. That is actually really awesome. And on the Corsi Rosenthal box thing, it's interesting. You're right. I did sort of say, we should just do this. And you're like, how about a little data? And it turned out the little bit of data was actually quite useful. And there is also evidence that, like, when you use Corsi Rosenthal boxes in schools, you can reduce infections and absenteeism by 40, 60%. That's a lot. Now, they are noisy, so there's efforts to try to get them a little bit, to be a little less noisy. But it's an amazing thing of what you can do if you just clean indoor air. All right, thank you for that. Alan, one more quick question to you, then we'll finish off with the last question for Beth. I was hoping you could talk a little bit about the new P20 grant that the school got, the university got, not that long ago, and why the focus on older people, on the elderly. And as you think about climate or extreme weather, what populations sort of concern you the most in terms of who's going to be most vulnerable?
Great, thanks so much. Well, so I joined Brown School of Public Health in the summer of 2023 under, relatively orange skies. If you'll recall, the Canadian wildfire smoke was drifting down, and during my first week, the dean maybe his second sentence was, that we really need to build a team to put in for a center development award. And so I was really fortunate to collaborate with a bunch of different scientists across the university, across the school, and the Institute at Brown for Environment and Society, and other units. And so we put in for an NIH, what's called a P20 award. So it's a 3-year award to develop capacity. And our climate and health focus of our award is on aging. So we have a new grant called Climate, Health, Aging, Innovation, Research, and Solutions for Communities, or CHAIRS-C. And it's sponsored by the National Institute on Aging. And one of the reasons that we're focused on this population is that they have some additional vulnerability. We're living in a society in which more and more of us are, we are all aging all the time. And this is something that we need to think about, but it's something that really does come up because when we think about more extreme weather, when we think about these recurrent environmental threats that keep happening, this is a group that's deeply impacted. And I think Brown has this incredible and long-standing track record of scholarship in this area. So it was a real opportunity for us to build on those strengths, to work with community partners, and to say, what can we do when we're bringing together, our environmental science, some pharmacoepidemiology, and in these partnerships to ask questions about how can we come up with solutions for healthy aging for all, in the face of these recurring environmental threats.
Awesome. All right, Beth, last question to you, and then we'll see if there are a couple of questions from the audience. You mentioned equitable climate futures. And we've talked a little bit about IBIS, the Institute at Brown for Environment and Society, a couple of times. Just wondering if you could talk a little bit more about ECF, Equitable Climate Futures, and really with the following lens, which is, a lot of places, a lot of universities have invested very substantially on, there are schools of the environment, there are schools focused on climate, there's large centers. But I have felt like there is a set of advantages Brown has around being multidisciplinary. And I'm wondering if you could talk a little bit about this new program on Equitable Climate Futures, how you see it, what its goals are, and why Brown might be uniquely poised to do something useful here.
Yeah. Well, Equitable Climate Futures, the initiative was really, I'm going to give Kim Cobb, the director of IBIS, a lot of credit for pushing this idea forward. And at IBIS, we are an interdisciplinary institute, where we draw on so many different disciplines with real intentionality. I'm going to say the other asset that Brown has is the Swearer Center for Engaged Scholarship and Learning. And so, the Equitable Climate Futures is really capitalizing on the interdisciplinarity of IBIS and moving to include communities really goes beyond interdisciplinarity or multidisciplinarity to make it transdisciplinary. You may wonder, what's the difference between all of those words? But I'm just going to leap to transdisciplinary. Transdisciplinary is the idea that when people tackle a problem and they work across disciplines to solve a real-world problem, you need lots of different perspectives on it. You need social science, you need environmental science, you need humanities, and you need community members. You need community members to reality check what the scientists are thinking, to tell us what we've got right, what we've got wrong, and then to also tell us what kind of solutions we might come up with that would be acceptable to them, that they could understand and use in a practical way. And that's really critical for accelerating the transition from science to application, to developing solutions. So Equitable Climate Futures is trying to bring together all of those partners to really do science better, faster, and come up with climate change solutions.
Awesome. Thank you. All right. Questions, comments, thoughts from the audience? We'll start here, go back, and then go back to the, yes.
So
Joan, hi.
Thanks. Recently, a number of us have been working hard to stop the use of leaf blowers and blowing particulate matter all over the place into our heads, our throats, all of that. So I wonder if you might speak on leaf blowers and air pollution.
Sure, I'm happy to take a try at that. So there's a couple different issues there. It's really a compound nuisance. One is that the two-stroke engines emit enormous amounts of noxious pollution. Another is that they're wildly noisy, right? And that's very aggravating. And then you pointed out just the act of kicking up that much dust in conjunction with their emissions, right? It means that it's really quite a source of particles and pollution that can aggravate human health. So, we've seen that some communities are addressing this faster than others. One of the things that the university is doing here is shifting away from using fossil fuels, and so they're using electrified, battery-operated equipment, and so that is substantially quieter, and it avoids some of those local emissions, right? There's still a question of how much leaf blowing do we really want, and what is the sort of ecologic benefit of having leaf blowing. So I think that there's going to be some middle ground that different communities assess and come to. I do think that moving away from the two-stroke motors is a big improvement, and so that's it is one of the cases of, as we electrify things, we may be able to reduce some of the local emissions, and then that can have local health benefits, and also hopefully be less of a nuisance.
And if Erica Walker were here, she would talk about how the noise pollution from these things has its own harm beyond being annoying. There's actually health effects of noise pollution,
absolutely.
which is something we don't spend, or at least before I met Erica, I would argue I had not spent enough time thinking about noise pollution as a real health threat. Yeah, go ahead.
Thank you.
And then we'll come to you in a bit.
David Zelaya, assistant professor in behavioral social sciences. So I'm also a native New Orleanian, so I'm excited to hear some of the work that y'all are doing. And a big point that we talked about in class were around, right, sort of coastal loss and coastal restoration around the Chitimacha and Homa Nation, Cancer Alley being, right, drastically impacting sort of black communities, lower SES. And so we're just wondering what the role or how you're all conceptualizing environmental justice moving forward in your work and sort of within the center.
So I think you hit on a key point, and that is that a lot of these issues are linked. So you have a coastal community with a lot of nearby, in Texas is another example, with oil refinery and plastic, manufacturing, et cetera, right? An area in the country with high cancer rates, and a socially vulnerable, demographic. And so I think these are, there's this vulnerability, this confluence of all these vulnerabilities, and I think the work we're doing here is we're starting to try to address that. Erica Walker is doing a lot of work down in Jackson, Mississippi, where if many of you, if you recall, it's over a year ago now, their water treatment plant failed. We had an American city that could not produce clean water for its inhabitants. And so she's been working with communities there to address questions related to noise and air pollution, but also their community concerns, which is that they really care about water. They just, they have boil water advisories all the time. And they find things that when they have these boil water advisories, student absenteeism goes up because there's more gastrointestinal illness keeping kids home. So, these issues are all intertwined, and there really does need to be an environmental justice lens that we look at through them, because these disparities and exposures often coexist.
Go ahead.
A lot of my thunder just got stolen. So actually, that's a good thing. Are there any cancer alleys in New England? Sure, I would speculate there's some in Delaware.
I know, I mean, there have been some cluster examinations of things, as well, and things in places like Cape Cod, as well as, around some dumping of trichloroethylene in some places in Woburn and other places. So there's been some sporadic cases of or clusters of cancer that have cropped up. I'm not aware of anyone thinking of it as an alley per se, but there are clusters that show up oftentimes in this region and others.
Great. Ira. Oh, sorry. I've been way too center focused. Please.
Hi, I'm a public health student, and I'm interested in the role of AI in climate and health changes. I recently read an article on the Harvard Business Review which said that training an AI model apparently results in fresh water resources getting depleted, and also it's so deeply energy intensive that it's depleting even the existing neural networks that feeds into these models. So as somebody who actively uses AI, not just for my assignments, but also otherwise, where, say I'm looking at a paper from NEJM or JAMA, and I don't understand the statistical modeling because it's very complex for me. So I go to AI or ChatGPT and I say, dumb it down for me, right? And when they're doing that, it's very, it's taxing for the model. I understand that because there are certain languages which I don't perceive easily. So I'm constantly feeding more information and training the model for me, right? So how do us as public health students be more conscientious and also make the use of AI more environmentally sustainable and also equitably distributed?
Yeah, so AI is awesome. It's also insanely energy intensive. What are we going to do about that, people? How are we going to fix this? 2 minutes. I want a solution. 2 minutes. Alan.
Well, so AI is in this early phase where we're all being sold that this is just an amazing product that mostly people are not yet even paying for, right? And that this is, the costs are all externalized because they're happening at some other data center somewhere else, right? And so I think as a society, part of the public health messaging needs to be connecting these things and saying that there are consequences that, increased use of data centers is leading to this massive expansion and this demand, which is bringing online. I don't know if people saw the reporting that the new data center that's feeding a very large company's AI has all these unregulated gas turbines around it, right? And so there's an energy cost and there's an environmental pollution cost to these things. I think that connection hasn't been made, just in the same way that we're in the early days and you're not even being asked to pay for it. The society at large is not even cognizant of that connection that you're making about the use of resources, about the way in which it's using up fresh water and the way it's really adding to energy demand and therefore contributing to emissions of air pollutants and greenhouse gases. So I think making that connection as you did there is going to be the first step. And we need this industry, we need to really think critically about some of the consequences that it's having. Thanks.
Anybody else on AI and energy? All right, we'll go to Ira Wilson next.
This is a question for Beth. So weather events like Hurricane Katrina, of course, can cause migration. Wars can cause migration. Wondered if you'd talk a little bit about the way a temperature or two, a degree or two of temperature affects fishing communities in Newfoundland, farmers in the Gambia, farmers in Guatemala. Is that a thing, and how big a thing is it for us to think about?
Well, I think the question becomes, when does a community hit a tipping point where the temperature is going to diminish livelihoods? And that's going to be a very local answer to that question. It depends, but if your question is specifically about how does temperature produce migration, I think we would want to look at places that are very close to that tipping point already because they're very warm. But I don't think that, the connection between environmental change and migration is nowhere near as direct as the connection between temperature and health or mortality. The heat really affects the body very directly, but it's going to affect livelihoods indirectly by maybe having more fish fish die-offs, or drying up water sources, or other sorts of environmental impacts. And humans are incredibly adaptable and have often figured out ways to adapt to, variability in temperature. And so you have to kind of be able to identify these complex pathways by which that adaptation is breaking down. And so, but I'm also going to say that migration is one of the last responses to environmental change. There are so many human responses that happen prior to that we really need to spend more time thinking about, like, how do humans adapt in their daily life to these environmental changes that can be very subtle adaptations. They can be more systematic adaptations, but people really love where they live typically, and they really don't want to move. And so they'll do a lot. They'll spend a lot of money to stay or an effort to stay where they live in their community. And it's only when you hit that, a really critical tipping point where people can no longer feed themselves or cope with the environment that you see people beginning to leave.
I was going to cut it off, but I heard there's one more student who has a question, so we're going to end with a student's question. Please. You get the last question.
Thank you so much. Thank you so much for all the work that you guys are doing. It sounds like it's really amazing. I have a great, profound interest in One Health and that kind of framework, implementing it into public health and how we look at public health. I was wondering what opportunities are there going to be or are underway to incorporate One Health through this center as an educational component or an opportunity for students to engage, whether it's through, the foundational courses that everyone is, required to do upon entering Brown's public health program, or more classes dedicated, anything to that effect.
As Monica was talking, and she was talking about all these things, it was like, wow, this is One Health. And I was thinking we really do need to have something on that.
And for those who don't know what One Health is, you want to just give a 30 or 10-second primer?
It's the idea that, everyone is interconnected in terms of health, whether it's the plants, the animals, the humans, and how we interact with our environment. And it's this idea of cyclicity with all of this, and that it's a system, not just a linear line. At least that's my simple understanding of it. And I think incorporating those sorts of elements into our curriculum would be important. And I think there's an opportunity to do that. Whether it's a separate class or it's in the basic public health curriculum that everyone takes through PHP 101, right? So
we're going to have a class next year, actually. One of our faculty is developing a class.
So we're going to have a class on One Health. Yes. All right. Let me take just 5 seconds to thank the panelists. Thank you all for the really excellent comments. I'm going to ask Frank Doyle, Professor of Engineering, 14th Provost of Brown University, our Chief Academic Officer. Thank you, Frank, for being here. Thanks for, I know it's a little bit of a crazy time, to say the least. On a good day, your job is busy, but thank you for taking some time and just sharing some remarks that you might have and reflections.
Yeah, I was going to say, the best part of the last 2 hours, I was at an AI panel, which I had to run over here for. And by the way, the energy question came up there, whoever posed that, yeah. Interesting discussion about that. But I had to run over here, so I apologize, Ashish, Monica, I missed your part of the program because I was running that panel. I made it for the faculty, so, Joe, Beth, Alan, that was fabulous. Thank you so much for that. I just want to share my own enthusiasm for what we're doing here in the launch of the center. In so many ways, this is a quintessentially Brunonian exercise, a real demonstration of the power of what we do here at Brown. And I think it really relates to two things. Those who don't know me, I've been here a relatively short time. This is only my second year here. And two of the things that I tell Chris Paxson time and again drew me in to Brown were what I'm going to call the secret sauce of what makes this endeavor so powerful. One of those, our boundaryless approach to scholarship. We really don't think about the silos of traditional departments, traditional schools. we tackle the big problems. And as big problems go, there is a particular big problem Ashish and I and others are wrestling with. It's not in the science domain. But in the science domain, big problems don't get much bigger than this. And as a chemical engineer, we like to pride ourselves on we're interdisciplinary and solve all kinds of problems. This is bigger than any field I know. This requires pulling environmental sciences together with climate sciences, with health policy, with big data, with policy as a field. So it really does motivate this approach to not having the walls, the silos that define many institutions, including many fine institutions I've had the privilege of working at. We're different here at Brown. The other advantage, the other part of our secret sauce, which I think got demonstrated today, is we do powerful things at our scale. In fact, our scale lends that interdisciplinarity. You get too big and you can't do interdisciplinary research. Trust me, I've been at a campus just north of here in a town called Cambridge. It's very difficult. You might be familiar with that campus. Very difficult at scales like that. I've also been to campuses that are so tiny they don't have schools per se. They have undergrads and PhDs and no professional schools. Hard to do things at that scale. We have sort of, I believe, the secret sauce of just the right complexity, just the right size, where we have bench depth. We have experts, as exhibited in the panel we just had, but we're not so unwieldy and clumsy that we trip over ourselves when we try to do something that lives at the nexus of all different fields like this. So I think that's another powerful part of this. Our scale brings power at another level, and that is that we can evaluate projects, we can engage with the community. You heard a lot about that. The ECF is a great example of that. So engaging with the community gives us a chance to build models of collaboration, to build prototypes, to evaluate impact. The projects with the schools and the trees is a great example of that. We can do that at the scale of a community, of a state, and then demonstrate prototyping in a way that, again, I used to live in Massachusetts. They can't prototype at the state scale the way we can here. So again, I think this center really leverages in a marvelous way two of the ingredients that I think are truly the secret sauce here. And I have to say, as I was thinking about the fields that collide here, big data, policy, I didn't even think of athletics. So I've got to rethink how I'm going to frame this and tell Grace Calhoun, our director of athletics, that marathons and data from marathons made a cameo in the panel here. That was great. Any event, I'm going to end my remarks here and say thank you all for coming. Thank you all for who contributed to the vision of what is now being realized with this center. And again, apologies, Monica, and thank you for giving the lecture today. And please join me in thanking everyone who contributed.